Let's begin tonight with security. The Chief of Army Staff, Lieutenant General Taoreed Lagbaja, says the Army will resist all calls for undemocratic intervention in governance, as it is not poised to lose the prestige it has painstakingly built in the past 25 years. He spoke at the opening ceremony of the Chief of Army Staff Combined 2nd and 3rd Quarters Conference 2024, held in Akwa Ibom State. TVC News' Miriam Daniels reports that Governor Moeno formally declared open this year's event.
The annual Chief of Army Staff Conference is holding this year in Uyo. With the arrival of the host governor, the conference kick-started. As he takes the podium, Governor Eno commended the Nigerian Army and other security agencies for their commitment to the peace and security of the state and the nation. He advises them to remain apolitical. As he says, his administration in the past donated 100 million naira to widows of fallen heroes in the state to improve their lives.
As the army of our great nation, your role in securing the nation is paramount, and the government is to do all that is possible to ensure that the army is well equipped. That is why we created the Joint Maritime Operations Task Force and procured and deployed 14 patrol gunboats in response to the literal nature of our state and the threat posed by sea pirates, militants, and kidnappers within our waterways.
Then, the Chief of Army Staff, during his speech, noted that food and social security issues can result in physical security challenges. He stated that the Nigerian Army, under his leadership, has launched several welfare programs for members of the force. The Army Chief states the commitment of the force to boost food availability in the country by supporting the federal government in its economic prosperity plan.
The Nigerian Army will not allow itself to be used to undemocratically sell some interests to power. As a service that received the most image bashing as a fallout of previous military interventions in Nigeria, the Nigerian Army is now poised to losing the new prestige it has painstakingly built in the past 25 years.
3 beneficiaries received checks under the welfare scheme of the force, and the week-long event will climax on Friday with a closing ceremony. Miriam Daniels, TVC News, Uyo, Akwa Ibom State.
Away from Akwa Ibom to Abuja, where the federal government today received 10,000 doses of the Genius vaccine as part of its response to mitigate the spread of Mpox. Receiving the donation, the Executive Director of the National Primary Healthcare Development Agency, Muya Ino, says the vaccines will be used to help protect the nation's vulnerable populations who remain at high risk. The current Mpox outbreak was declared a public health emergency of international concern by the World Health Organization 2 weeks ago.
The highest number of cases, many of them are in the south. But of course, we're going to have to work with the states to develop state-specific plans, to make sure that the vaccine is appropriately deployed. Now we have the vaccine. I witnessed the vaccines being, some pictures and videos of the vaccines being loaded on the trucks to our store today. So anytime from this week, with the micro-planning roll out and the implementation agreement with the states will kick off.
Nigeria government has put together a vaccination plan. So there's a plan how to use these vaccines effectively, how to make sure we get the most effect out of this 10,000 vaccine donation. So that's very much why Nigeria was chosen to receive this first batch. We will continue to work with Nigeria on efforts to stop the spread of the monkeypox illness, and we will continue to look at how we can help Nigeria.
Now, for more update, the Executive Director, National Primary Healthcare Development Agency, Dr. Muya Ino, joins me on the news. Good to have you join us.
Thank you very much. Very glad to be here.
So we just received vials of the Mpox vaccine Genius. Tell us how important these vaccines will be in terms of our response in the country, and will they be enough to mitigate the current outbreak?
I think, like many people already know, part of the objectives of President Tinubu's Nigeria Health Sector Renewal Investment Initiative is to make basic health care, including preventive care, available for all Nigerians. Vaccination against vaccine-preventable diseases is a part of it. We have a routine vaccination program, but the Mpox vaccine is not one of such. But, you know, we have had quite an outbreak over the last few months. Nigeria had a substantial outbreak in 2022, but there was no vaccine available at the time. We've had a few cases, about 37 cases in all as at the last count across the country, which is substantial. Unfortunately, we have not recorded any deaths. So we hope to keep it so. We hope to stop the transmission of the Mpox virus. So we reached out to our partners, and the US government was gracious to donate 10,000 doses to us. Now, this 10,000 doses is not going to cover everywhere. It's important to state that globally, there are only about 200,000 doses available in this first wave. We're able to get 10,000, so we're working with states to prioritize where we will deploy it, targeting the most vulnerable populations, the frontline health workers, and co. So while we will continue to educate our population about hygienic behaviors, avoiding contact with sick people, and seeking care as soon as you feel the symptoms of headache, general malaise, fever, maybe swellings around the neck and other areas with lymph nodes. We need to, you know, the vaccine is a critical addition to our strategy as a country. Thank you.
Interesting. You already, because I was going to ask you about how you plan to distribute it, but you already mentioned that. Let's talk about, you know, the struggle with vaccine supply in Africa, especially now that the demand for these vaccines is quite high. Given the Mpox outbreak being a global public health emergency now, has been declared by WHO. Do we have plans of production locally? Because there was a plan like that for COVID-19. What is the plan to acquire more?
So I think there is a broad national strategy around vaccine production. The country, as part of the healthcare value chain component of the health sector strategy that we're leading now under Minister Mohamed Ali Pate, really is driving towards local production of vaccine. That does a number of things. Like you said, it guarantees our supply chain a bit more. It also saves us costs, at least in the long run. However, vaccine production is not an on or off thing. It's a long lead time to build the capabilities and the competence to do it. So while we have made substantial progress in this demand, it's targeting vaccines for some of the diseases that affect us a lot more. I think the incidence of monkeypox in Nigeria at this time may not, in my perspective, warrant it being the priority vaccine that we will focus on. But there are many other illnesses, measles vaccines, yellow fever vaccines, even Lassa fever vaccines that are sometimes unique to us, but more importantly, they affect a lot more of our people. I think those are the immediate priorities. Thank you.
Thank you so much, Dr. Muya. I know I'm sure that we'll have you again and again as you make plans to mitigate this current outbreak. We've been speaking with Executive Director, National Primary Healthcare Development Agency, Dr. Muya. I know. Thank you for your time.
Thank you.
Well, let's turn